history in your family.
Right.
So can you tell me like some about your family's history?
My mom had COPD and breast cancer, and my dad had pancreatic cancer and dementia. And then my grandparents also, my mom's mom had breast cancer, and her dad had lung cancer.
Okay, so you have like a history of cancer in your family, but you don't have any colon or rectal cancer
No.
in your family. Well, I still think it's a good idea. They've changed the guidelines. The American Cancer Society has changed the guidelines from 50 to 45, and now that you're 47 years old, I think it would be really good, like if you took the steps to get some screening done to make sure that you're clear, because I know you want to be around for your girls. So what they do is they're just looking for precancerous polyps, and if they can catch them early enough, they just cut them out, and it completely prevents colon cancer or rectal cancer. So there's different ways that they can do it. There's like 6 different tests that you can go through, and you can make a decision on what works best for you. Most insurance covers the cost of the tests. Sorry about my cat's everywhere. But you haven't, there's some symptoms to look for that you really need to go in immediately for. Do you have any like blood in any of your bowel movements that you noticed?
No.
Okay. Or do you have any stomach pains, aches, or cramps that won't go away?
Not really, no.
Okay. And then have you lost any weight and don't know why?
No, I wish.
Okay. Well, those are signs that like are definite like triggers of where you should go in like like immediately. But since you don't have those, just set up a time that's best for you. You can talk to your doctor and decide what works for you. I wanted to show you some tests that we have. There's several stool tests that you can do, and you can get some of these are over the counter at the CVS or Walgreens, or the doctor will send you a kit for it. So I'm going to show you, these are from the American Cancer Society that you can pull up. And I don't know if you want to do these or not, because these tests have to be done once a year. And they'll send you a kit, and you take a stool sample yourself, and then you have to put them on one of these cards and send it back to the doctor, to the lab. And like I said, your insurance should cover it. You don't have to take off any time from work for it, and you do it at your own convenience at your home. And then it's called immunochemical test for that one. And then there's another one that usually goes just by FOBT, a high sensitivity phase people full blood test. It's kind of the same thing. The doctor will tell you to avoid before you take it, but you don't have to really do any pre-treatments before you do it. It's the same thing. You take a small sample, place it on the card as it's shown in this demonstration card, and you do it with 3 separate documents, so not just one, 3 separate ones onto this card, which probably won't work for you because you guys use the bathroom and stuff. It's a little bit messy or whatever. You don't have to take any time off, but it's checking for blood in your stool as well. So that's an option for it. And then this one is called, it's the multi-target stool DNA, and it's actually looking for a change in your cell DNA to look for cancer, which is kind of interesting that they can do that. And this is also showing your abnormal DNA is, I'm sorry about that, is could mean that there's polyps or cancer. And so you don't have to change your diet for this test. You just do the same thing. You do a bowel sample, you put it in a sample vial, and then you mail it back to the lab. And you don't have to take any time off. And these are all 3, if you look these over, these are all annual. Insurance will cover them.
Okay.
And you don't have to take any time off from work. But like I said, it's once a year, so you really have to be diligent about following up on it. You can throw her off. Sorry about that. So then there's another one that they do. It's called a CT colonography that they do. And so this one is the day before. They'll give you like a prep where you'll do like a clear liquid diet, and you'll do a prep for something to drink and you want to like totally cleanse your bowels. It'll cause you to have diarrhea, so you need to stay near a toilet. So this basically the next 3 procedures are all ones where you're going to go into the facility, into the doctor's office. So you're going to, in each of these, you're going to do a treatment. They'll call a prescription in for you for the CVS or wherever your pharmacy is, and you prepare it the night before, and it'll be in a big gallon jug, and you just are supposed to like drink it. I believe it's within 2 hours. There's an instruction on it that'll tell you, and just stay by the toilet. It works really quickly, and it empties your bowels out, and then you can't have anything but clear fluid after that, and you can't eat. You can take any medications that you have, just with a sip of water before the test, but you really want to have everything absolutely cleaned out. So, and then when you get into there, they're going to take a tube and insert air up into your colon with a small tube, and the only thing you might feel like a little bit of discomfort or something. Most people don't. You may need to take some time off of work, because just for the amount of time that it takes, because you have to go fill out your paperwork. You're going to go through an x-ray after that, and it's an x-ray machine like this, and they're going to take a look with that air up there and take a look at your bowels and see what they can see. And this is done every 5 years. If any of these tests turn out too, by the way, that they turn out positive, then your doctor's probably going to have you follow up with a colonoscopy anyway. So these are all 3. That one is 5, and then this one is 5 as well. And this one is a flexible sigmoidoscopy, and it's a visual test done by your doctor. It's very, very similar to the colonoscopy. The day before, you're going to do that clear liquid diet, and instead of drinking these fluids, you're going to do 2 enemas, and this will like clean out your bowels before you go in. You may feel a little pressure and cramping just because you're going to have diarrhea and getting rid of it. This is another one where you're going to have to do every 5 years, and you might have to take half a day off to prepare because you're going to, go into the office. So they're going to take like a small camera and a small tube, and they're going to put it up through your rectum into the lower part of your colon, which is called your sigmoid. And they're going to take a glance at that.
Are you awake for that?
Yeah, you're awake for it. Sometimes they give you something to relax you, but you're awake for this. It's just not as invasive as a colonoscopy. And to be honest with you, I'm not sure why somebody would choose this option over a colonoscopy, but it is an option. So this one is every 5 years, just so you have all the information and the facts about it. This is the colonoscopy. It's the easiest. You do the same prep the night before. You drink the fluids. You stay by the toilet. This one you have to have somebody drive you to and from the hospital. You can't work, obviously. And they usually give you something to relax you at first, and then they put you in twilight sleep. So you're not going to be awake for the procedure. You're not going to remember it. You remember kind of counting down before the procedure, and then you wake up and it's over. And so they go in, the same thing with a tube and the camera, and they go up and look. And if while they're up there and they see any of the polyps at that time, they're going to go ahead and take them out. So you're not going to have to come back. You're not going to have to go through it again. They're going to go and like take whatever they find out when they're there right now, and they're going to take images of it so they can like clearly, look at it, make sure everything is out and that you're good. And this one is every 10 years. And then, so what I wanted to tell you about this one too is, I think you told me you have Blue Cross Blue Shield.
Correct.
And I know that if you go to their website on Blue Cross Blue Shield and you put in what elective procedure that you need to do, it'll usually give you recommendations of where you should go for the doctor. And having gone for one myself, I know when I put it in for the colonoscopy, it recommended a couple places that even suggested they paid me if I would choose that hospital. So when I went, I got a check for $350 back from my insurance company for choosing that hospital. So those are your options. So are there any any of them that you're leaning towards for one reason or another?
I would definitely go with the colonoscopy. It just seems to make the most sense.
Yeah. And
Once every 10 years, and they clear it out if there's a problem.
yeah, exactly. Because any of these, they test positive. You're gonna have to go in for this anyway. And then this one, like I said, while they're up there, they're just gonna remove the problem while they're there. And if there's nothing there, great. Then you don't go back for 10 more years.
How often do you have to go back if they find something?
Well, they take it out. They do a biopsy of it.
But you don't have to go back sooner.
No, I'm sure it depends on what it is. When they've taken it out, they'll do a biopsy of it, and if it's something